Thanks for tuning in. I'm going to give a quick presentation of a really fascinating case. This is a woman in her 60s who presented with a new onset rash in her lower extremities that was seen by a primary care physician. I received the photo of the rash, and this was in the early days of COVID, and I called the patient who did not want to come into clinic. She has this rash, it doesn't really hurt, non-itching, and she otherwise feels well. So the concern is when you have a rash that looks suspicious for leukocytoclastic vasculitis, we have to make sure there's no systemic involvement. So I asked her to come in to get labs drawn, and the labs showed the following. So we have creatinine at 2.5, and her urinalysis is 2+ blood. She had a normal creatinine prior. So the big concern here is obviously she has renal involvement with the glomerulonephritis. But let's take a look at her other labs. Her white count is normal, her hemoglobin is a little bit low, and her platelets are on the low end. Also, her C3 is low, and her C4 is normal, but her rheumatoid factor is positive. So this gives us pause a little bit, right? Normally in active vasculitis, we expect the white count to be a little high and the platelets to be high. Her platelets are on the low end. Now, also in ANCA vasculitis, which can cause glomerulonephritis, we often see normal complements. Her C3 is low. What about cryoglobulinemic vasculitis? Well, that can cause a positive rheumatoid factor, but it normally causes low C4 instead of low C3. So this is not quite adding up. So she also had a p-ANCA positive in that lab test. But we're really jumping on this ANCA bandwagon. This is ANCA vasculitis when her platelets aren't quite adding up, her complements aren't quite adding up, but she otherwise feels normal. So she's actually hospitalized because of her worsening renal function, and quickly her blood cultures came back positive for strep viridans. She actually had both mitral and aortic endocarditis that was causing a leukocytoclastic vasculitis. So this is a great example of a case of what looks like systemic vasculitis, but it was actually infective endocarditis. So it's really important to catch this, obviously, as immunosuppression would have been fatal in this patient. Thanks for taking a listen.